Texture-modified diet. Mr. Tan is having radiation therapy following a neck cancer surgery. Currently, he has difficulty in swallowing, which is medically known as dysphagia. Dysphagia is a common symptom caused by the treatment of head and neck cancers. The treatment may cause alterations in taste and smell, as well as pain when swallowing food. This diminishes the motivation to eat, leading to malnutrition and dehydration. Patients often replace their normal diet with a liquid-only diet, such as plain diluted porridge. While this often provides some relief of the symptoms, it often results in reduced caloric and nutrient intake and renders Mr. Tan unable to meet the nutritional requirements for optimal healing. A texture-modified diet changes the consistency of foods and liquids to make them safer and easier to swallow. A speech therapist would be able to advise on the right texture and thus would help Mr. Tan to eat while providing the nutrients for his recovery. The International Dysphagia Diet Standardization Initiative, or IDDSI framework, provides the global standardized classification for texture-modified foods and thickened liquids used for individuals with dysphagia. We will demonstrate how regular foods can be modified into minced and moist, pureed and liquidized. Recipe: stir-fried chicken with mushroom. Ingredients: dried shiitake mushrooms, chicken minced, light and dark soy sauces, sesame oil, ginger minced, sugar, salt, pepper, olive oil and cornstarch. Shiitake mushrooms are soaked in warm water for 3 minutes or until they become soft. They are then drained, diced, seasoned with light and dark soy sauces and set aside. In a separate bowl, the minced chicken is marinated with sesame oil, ginger, sugar, salt and pepper for 10 minutes before setting it aside. Olive oil is heated in a saucepan and the marinated chicken is placed into the saucepan. Fry for 4 minutes until fully cooked and well separated. The mushrooms are added into the saucepan and the frying continues for 2 minutes. Add a bit of water to the cornstarch to make a slurry. This is then added and the stir-frying continues for another 2 minutes to thicken the sauce. The saucepan is removed from the heat and the dish may be served or blended into different textures. The recipe can be modified into 3 different textures, namely IDDSI Level 5, minced and moist. 100 grams of cooked minced chicken and mushrooms are placed in a food processor and chopped. IDDSI Level 4, pureed. 100 grams of cooked minced chicken and mushrooms and 40 milliliters of chicken stock are added into the processor and blended. IDDSI Level 3, liquidized. 100 grams of cooked minced chicken and mushrooms and 100 milliliters of chicken stock are added into the processor and blended. After each variation is prepared, a fork drip test is conducted to assess food flow through the prongs of a fork and comparing against the descriptions of each level for texture and consistency. IDDSI Level 5. Food is minced and moist, and it is cohesive enough to hold its shape, and it does not dollop, drip, or continuously flow through the prongs of the fork. IDDSI Level 4. Food is pureed and has extremely thick consistency. It does not dollop, drip, or continuously flow through the prongs of the fork. A small amount may flow through and form a tail below the fork. IDDSI Level 3. Food is liquidized and has a moderately thick consistency. It drips slowly or in dollops or strands through the prongs of the fork. It can be drunk from a cup but not eaten by a fork. Each individual can modify their regular recipe into the appropriate texture for each phase of the recovery. It is important to have a balanced diet and to get the right nutrients, enough carbohydrate, protein, fat, fiber, vitamins and minerals in daily diet. Remember that you are not in this alone. Reach out for help and surround yourself with the right knowledge and support. CanHope's professional allied health team is available to guide you through the difficult post-cancer diagnosis period and give you peace of mind.